I think first it's very important. Once again, please go for vaccination. The winter is coming, so protect yourselves and protect your families.
Taiwan's healthcare system, particularly its national health insurance, is widely considered one of the best in the world, offering universal coverage, high accessibility, low costs, and a single-payer system. This week on Taiwan Talk, the Deputy Minister of Health and Welfare sits down with us to discuss what the government is doing to improve public health. Dr. Lin Jing-yi enjoys a solid background in both the medical field and in politics. She started out her career as an OBG and was also a volunteer medic working in various nations, including Nepal, India, and Tuvalu. Her public service career began a decade ago, serving as a DPP lawmaker for 6 years, and was a spokesperson for President Tsai Ing-wen during her re-election campaign in 2020. She joined the Ministry of Health and Welfare this year with the inauguration of President Lai Ching-te. We started out talking about her new role and how she uses her unique skill set to communicate between her ministry and lawmakers and the general public.
I think my responsibility first is to help to communicate between Parliament and our department, especially the policy and Berge communications. And second, of course, we need to have some communication between the professional organizations and the policies, and make our populations more understand those very important policies, especially for health. I'm so happy to work here because, I have a medical background, but also I had ever worked in Parliament. So many important policies actually I had care about. Now I could do that. I could push that more directly.
What is the role of the Health and Welfare Ministry to improve the quality of life here in Taiwan?
It's a very important topic because as the data, we have almost 10% our life actually is on health in Taiwan. It means our people actually we need to focus more preventions, medicines, but also to encourage people to have a more health lifestyle. Of course, Taiwan actually, you could see people love to exercise, and we really care about the health, food, the food securities. But we still need to have a better chronic disease management, and to have a better the treatment for our cancer and some very important disease. So now we in our health and welfare department, we not only care about the mental health, chronic disease, prevention and control, but also we have a very important missions to improve our cancer treatment. But also we need to have a more cancer screening for our populations. So another, of course, because we just passed a pandemic, so we still have the work to cooperate with international friends about how to prevent communicated disease with our partners.
Taiwan's national health insurance is very widely praised internationally. And people working in Taiwan legally with an ARC, they're also included in this service.
Yes.
So are there any special programs that your ministry is doing to promote help for foreign residents, or maybe just help them better understand the NHI and maybe remove any misconceptions they may have?
Yes, for example, during pandemic, we have a different language, the news publications and information for our old friends working in Taiwan to more understanding about our policies and to protect themselves. So we really so appreciate so many friends from other countries to work in Taiwan. So we also have the same health rights and with Taiwanese people, so they are included in our health insurance. I think that is a responsibility for all our peoples, not only in Taiwanese but also our foreigner people in Taiwan.
With Taiwan's aging population, Lin says the MOHW not only wants to help the elderly stay healthy, but also encourage fitness among the young and old alike.
Sure, we are became the very senior populations in Taiwan, but the elderly population not mean unhealth. We hope every populations could keep their health, so the young population need to have a more better the habits for their food and exercise to take care of themselves. And for the elderly populations, we have policies to help them to prevent the disease, prevent them decrease their function. Some people maybe they get chronic disease or even have stroke, but the long-term care and the medical service will improve their function. So I think we will try different way to encourage every people to understand they have the right, but also they have also the responsibility to make them become more health. That is our, but of course that also is our responsibilities.
At the same time, Lin says a new emphasis on preventative medicine is also part of the ministry's strategy.
I think maybe you have noticed that we have a lot of strays and loading in our health insurance. Because Taiwan now we have a lower birth rate and become elderly populations. So for chronic disease control and the complication of the chronic disease, that is really our loadings. So now this since this May, the President Lai Jing-yi, we have a new policies we called add, and add. It means we will include more the populations to understand if they are at risk for chronic disease. It means we hope have at least 80% populations with the chronic disease risk could know they are in the risk, and 80% of them could to receive the consultation to change their lifestyle, more healthier in food, activities, lose their body weight, and 80 of them could have control about their sugar, blood pressure, and cholesterol. So we have these programs. We were set up from the screening, consultations, and medical treatment for these populations. I think that will be a huge job, but actually that is really, really important to make our people more health and decrease the disease loading for all the people.
I know the other day in the office we were having a meeting, and one of my colleagues, he was talking about how important it is to have the preventative medicine. So what are your plans maybe to make that information more well known to the public?
We will have different way to announce these programs. First line actually is our primary doctors. The primary medicine doctors, actually they are most close with our populations. So when they go for vaccinations, they go for some clinics visit, doctors will encourage them to more care about their health and get a screening. Second, we will have some announcements about that. Maybe some very famous people were to announce that, to encourage people to get the prevention medicines. But also actually we have a cancer screening. Every year we encourage people to receive the cancer screening. So of course for the most of people they worry about cancer, because that cancer is our leading death risk factors. So the more people care about that, we will have another side to encourage them to receive the screening. We have a breast cancer screening, lung cancer screenings, oral cancer screenings, colon cancer screenings, and the cervical cancer screenings. So please, I think to do the screening is very easier. All the doctors could to provide this kind of service, and so please, all the audience, you could receive the screenings. If you need more information, you could ask your doctors.
And health is more than just physical. It's also mental.
Yes.
And maybe at times society overlooks mental health. And I think maybe in the past it's kind of been a stigma in Taiwan. But that can have very devastating consequences. It can cause family problems where people don't understand how to deal with a person with mental health, or it could even lead to something like suicide. So what is the Ministry of Health and Welfare doing to help counter this problem and educate the public?
I really so happy you asked these questions. It's really, especially for young populations, the suicide death actually is a major of the reason of death. And actually, we found more and more young populations, they are suffering in mental illness. So we initiated programs for young populations, consultation programs since last year. We provide 15 years to 20 years old populations. They could have 3 times free counseling to receive the counseling service for them. This is very popular. Actually, we got a lot of young populations, they go for this service. It's almost 30,000 people receive this service, and one of third of them, actually they are be referred for further treatment. And so this year we to widening this service, we provide this service for 15 years to 45 years old populations. I think that the policies first it actually could to change the stigma. The young populations they could aware about, they could receive this service. You do not need to worry about the stigma or for some very bad informations. And second, they could aware about how to care their mental health. And they could aware about their situation. When they feel something wrong in their health, mental health, they could go for get professional help. So this is very important, and we do the policies since last year. Actually, we could see we decrease the young population suicide rate, but also we care about elderly population's mental health. So the long-term care policies and long-term care service for our elderly populations encourage them go to their society, more activity, decrease the lonely situation. Actually, all of that are help our population have a better mental health.
Finally, with the colder winter months upon us, now is time for the public to get their COVID and flu shots.
Now we have beginning our vaccinations for flu and COVID. I think I know everyone are so exhausted about the vaccinations since pandemic, but it's still very important. So this year we have initiated our vaccination for especially elderly populations, high-risk populations, and this time we will have a different policies. Is we will have the shot at the same times, one arm for flu, one arm for COVID. So don't worry, that is safe. And it's good. It is safe for your health, but also could let the risk populations to prevent severe disease. So please, the populations that could to accept the vaccination. I think that is really important, especially no one knows when the pandemic will come again. So vaccination is very important for that.
And I know overseas, well, like talking to some of my friends back in the States, they were already doing the 2 shots at the same time. Mm-hmm. But I talked to a friend here in Taiwan, another foreign friend, and he was kind of afraid, when I got the COVID shot, I really felt, down for a day. And if I get 2 shots at the same time, isn't that going to really knock me out? Do you think that's a valid concern, or is that something that you've been able to adopt for?
Yeah, now as the knowledge and the data, we really think 2 shots at the same time is better, because it will not make you. We do not need to remind you when you go for the shot. Of course, we really know some people they worry about the vaccine, especially after pandemic. They got too many side effect informations. But I really want to mention that the side effect is really teeny for some populations. Most of the populations, they be protected by vaccine. So now we have provided the people that maybe elderly, over 50 years old populations could get the vaccine. Please don't worry, and you could ask your doctors. He or she will make evaluation for you.
That was Dr. Lin Jing-yi, the Deputy Minister of Health and Welfare. For Taiwan Talk, I'm Tim Berge.